welcome to the studio. We have a special program on coronavirus. We are sitting with Dr. Yadu Singh. Dr. Yadu Singh, welcome to the program.
Thank
And
you.
thank you for your time. And Dr. Yadu Singh, tell us about what is the coronavirus and how serious the matter is.
Right. Varun, coronavirus is a new virus. It's a novel virus which has never been found with humans in the past until December last year. It has jumped from animals, snakes and bats and things like that, to the humans. And because humans do not have immunity, it's a big problem. It's affecting people in more than 120 countries in the world, and it's more than 183,000 people are infected and more than 7,000 people have died. In Australia, where we live, there are more than 450 people who have been found to be infected and 5 people have died. It's a huge problem. People say, Varun, that you can multiply these numbers, particularly the infected numbers, by 4 to 5 times to get the real numbers of people who are infected. So it's a huge problem. It's growing exponentially. It's a huge problem in the sense it's affecting more and more people. It's affecting economy. It's affecting travel and businesses. It's a very big problem.
How it spreads?
See, coronavirus doesn't go from air as such, but it spreads through droplets from your nose, from your mouth. So, and of course, if somebody has droplets on their hands, and if the droplets are also on the surface like table or chair, so those droplets you can touch by putting your hand there, and those droplets then can go to your body if you touch your face, rub your eyes, or touch your mucosa, the inner layer of your mouth or nose. So droplets is the way it spreads from one to other person. So it's very important because some people do not have symptoms, but they may be infectious. And if they are sneezing, coughing, or talking and droplets are going, they may be going to your eyes, your nose, your face, your mouth, or if they go on the surface like table and chair, or the doorknobs or the lift buttons or those things, if droplets are there and if you touch them and then you use your infected hands putting them on your face and nose and eyes, then you can get infected.
So, what are the symptoms?
Coronavirus symptoms are not very different from what symptoms you get with flu. Okay. So throat, headache, fever, runny nose, weakness, and of course, in the worst case, you get breathlessness, you get breathing difficulties, particularly if this virus has given you pneumonia. So, like flu, sore throat, runny nose, headache, fever, and of course then breathing trouble if you have pneumonia from this virus. So these are the symptoms.
So is there any treatment?
There is no treatment right now. There is no vaccine right now. So treatment is basically supportive treatment when you need to be in the hospital. Not everybody needs to be admitted. You need admissions only when you have a bad form of viral infection in the form of pneumonia, you are not able to get enough oxygen, you are breathless, you are not able to get enough oxygen in your system, and you need to be admitted. Basically, getting support from the ICU or from the ward or from the ventilator, but that's the worst scenario. 80% of people with coronavirus have mild disease. They do not have severe disease and they do not need admission. 80%. Only about 1 to 3%, more towards 3% people actually have bad symptoms, bad manifestation, and lungs getting infected. They need the ventilation and they are the people who are dying. So up to 3% people are having deaths, and they are the people who actually would need help in ICU, and they will probably need help from ventilator. And so that's the symptoms, and these are people who need help.
So how people can protect themselves from the infection?
That's right. So number one thing is that we need to be socially aware, socially conscious, socially caring, not only towards ourselves, but also towards people who are around us. And the way we do it is by having good personal hygiene, such as covering our cough and sneeze with the tissue paper or handkerchief. Covering, not with the hands, no, covering our face and nose when we are coughing and sneezing. And if you don't have tissue paper, then you can sneeze or cough in your elbow, but not on the
Okay,
hands,
not on the
not the hands. So that's number one. And then, of course, you dispose of your shirt and all those things properly, clean and all those
Yeah.
things. So that's number one. Then disposing of the tissue paper which you have used for coughing and sneezing nicely and carefully. That's number two. Number three, the washing your hands often, frequently with soap and water properly, not just like this, doing for 20 seconds.
Yeah.
For 20 seconds, soap and water frequently. Every time you touch a table, every time you touch a lift button or the doorknob or the pole in the public transport, anytime your hands get soiled with possible droplets from infected surfaces, you need to wash your hands with soap and water. That's number next. And of course, if you don't have soap and water, you should cleanse your hands using an alcohol-based sanitizer, which you can buy commercially. That's one thing. Now, if you are using table and chairs, please use a disinfectant and clean the surface of your table, chair, lift door. You won't be cleaning lift door because you don't own it. But what I'm saying is that those surfaces which may be infected with droplets should be cleaned. So that's the next one. And of course, if you are sick, please don't go outside. Yeah. Stay at home. Stay at home, self-isolate. If you don't have breathing difficulties, you don't really need to go and see a doctor. So if you do not have bad forms of symptoms from this infection, then mild symptoms, you only need to isolate yourself. And if you are in the home, you use the surgical mask to not allow your droplets from nose and throat and mouth to go out to surfaces and other people. That's very important. And it's very important that mobile phone, keys and wallets, also you use that alcohol-based sanitizers to clean it frequently, because we talk, sometimes we're talking on the speaker phone and droplets are going there. Yeah. So clean it frequently with the same sanitizer which you are using for your hand cleaning. So these are the things which you should do. And one more thing you should do is to have a gap, a distance between two people.
I'm going to ask these days, especially the social distance.
Yeah, we will go about that, but I will just add this here as well. Please keep a gap of at least 4.5 feet, which means 1.5 meters. 1.5 meters distance should be maintained. I think we are almost 1.5 meters. So keep a distance of 1.5 meters between you and others to avoid, to prevent droplets going onto you or surfaces. That's very important. So washing your hands. And one more thing, do not touch your face, do not rub your eyes, and do not put your finger in the nose or in the mouth, because your hands may be infected, may have the droplets and the virus. And if you do this, you are introducing that virus or viruses into your body. Do not do that. That's very important. So these are the things which you should do to practice a good personal hygiene.
And especially, Dr. Yaduji, these days all the events are cancelled. All more than 500 people are not going to get together one place. Is it only that is 500 people or less than also?
Well, that is the governments everywhere are talking about social distancing. Yes. So there's a word called social distancing. This is a good mechanism to reduce the rate of infection or transmission of infection. What they are trying to achieve is they don't want to have the peak of infection, like infection is starting, we have 452 people infected. We don't want this infection rate or number of people getting infected going like this. So tomorrow we don't want 2,000 or 4,000. The numbers will grow, but numbers should grow like this, slowly going up. So the peak is delayed, or the curve which could have gone boom, 200 today, 400 tomorrow, and then 5,000 tomorrow. No, we don't want the peak like that. We want the graph, the curve to be a bit flat, so that we have time to work on how to prevent, so that we have enough facilities in the hospital, we have beds in the hospital, we have ventilators, we have ICU beds. So flattening the curve is a very good mechanism to be prepared to deal with people who need help in the health system. So social distancing does that. It slows down the transmission. It doesn't stop it. It slows down the rate of growth of infections, and that's social distancing. How do you do this? Number one, same thing. Many of things we have talked about are applicable here as well. Do not go to any crowd. I will say avoid crowd. I know the government here has said 500. I know that Donald Trump has said 10 people. I know France has said 100 people. I say avoid any crowd. That's number one. Number two, if you have to go somewhere, please keep a distance of minimum 1.5 meters, which means 4.5 feet. That's number two. And number three, do not have body contacts. So no hugging, no handshaking, no face-to-face, the social, kissing, none of those things. Basically, you do namaste, you do salam, or you do air waving. Do not have, because why? Because your hands may be infected with the droplets and virus. So you don't want to pass on from one to other. So keep a distance of 4.5 meters minimum. Don't go to any crowd. And particularly, do not go to places where there are people who are more prone to have infection, like aged care facilities, like remote aboriginal communities. Do not go there because they are more prone due to lower immune system. So avoid them. And more importantly, if you do go there, you have to go there, please maintain the gap of 4.5 meters. That's very important.
So what is the exact social distancing?
Varun, this is a very common word we are hearing at the moment, because every government persons, every health practitioner, the chief medical officer here in Australia, they're all talking about social distancing. What is it? See, if we do not do anything and virus spreads like it normally spreads, then the infection rate will go very high. A lot of people will get infected, and the peak of this will come very quickly. So infection and going like this. Okay, now the number of people infected, and therefore some of them getting respiratory problem, pneumonia and other issues, they will need help in the hospital. So if you have big numbers, you will need beds and all those for those people, and we will not have the facilities. So our aim is, the government's aim is, the public health officials' aim is to flatten the curve. Rather than curve going like that, we want the curve to go like this, and it peaks here. We have plenty of time in the process to prepare ourselves for the beds, for the ventilators, for the health facilities, all those things, mask and whatnot. So social distancing basically reduces the rate of infection going to our people. Now, what that means is, how do you achieve that? We talked about personal hygiene. They are all very important. You practice that. But more importantly, you stay at home if you are unwell, because you are more likely to spread the droplets. When you are sick, you will be coughing, sneezing. So stay at home, in your own room, with your own toilet, bathroom, with your own cup. Don't mix with other people. So that's one thing. So stay at home when you are not well. Number one. Number two, avoid large gathering. In Australia, they say 500. I think they're talking about bringing the number to 100. I know that in USA, the number is 10. In France, the number is 100. I say avoid any crowd. It does not matter how many people. Avoid the crowd, because you have a risk of getting infection from the crowd, even from two people, or risk of passing an infection. So avoid crowds. That's number two. And keeping a distance, a gap of at least 1.5 meters, which means 4.5 feet from you and others. Initially, they were talking about 3 feet. But in America, they have 2 meters, 6 feet. I think we have gone in the middle. So 4.5 feet gap we should maintain between ourselves and other person. Why? When you have droplets from your sneeze or your sneezing or your coughing, they fly like this and they fall within 4.5 feet. So they go and they fall. So if you are sitting at a distance, my droplets would not go on your face or eyes or nose. That's the purpose. So avoid that. And of course, minimize the contact with other person. So our social culture of hugging, no, absolute no. Our social culture of shaking hand, no, because we may have virus in our hand. So namaste is very good, salam is very good, air waving is very good. So no unnecessary physical contact with the other person, particularly for those people like aged care facilities, nursing homes, like people who are elderly, like people who have chronic disease like lung disease, heart disease, diabetes, and those people who have immunocompromised health, avoid contact with them because they are more prone to have infection, catching infection, and more prone to have bad consequences, including death as well. So that's social distancing. Not only your personal hygiene, but more importantly, you reduce the chance of infecting others by staying away from the circulation. That's very important.
Doctor, very one more another important question. What about the immigration? What about the 14 days people are going and coming from overseas?
But that's also part of social distancing.
Yes.
So if you are coming from anywhere overseas, anywhere, be that India, USA, doesn't matter, any foreign country you are coming to Australia, you are required by directions of this country,
Yes.
the government, to self-isolate for 14 days.
Yeah.
That's very important. 14 days you need to be self-isolating yourself so that you are not passing on infection to others. That's very important.
And important for you also.
Yeah, everybody. I mean, the people are coming from overseas and you need to be staying at home, wherever you are, 14 days, self-isolate. That's very important. If you have symptoms, particularly high fever, breathing difficulties, you will need to seek medical advice. How you do it? Again, social distancing. You need to call the GP's practice before you go there. You tell them that you have come from whichever country and you have these symptoms. They will tell you what to do. Do not just go there, because the GP practice, the staff there has to be prepared to reduce the chance of they getting infected from you. So it's important to call them ahead before you go there. So isolate yourself.
Proper appointment.
Correct. So inform them, and of course self-isolate yourself. Now, not everybody with this virus needs treatment. If you have mild treatment, runny nose, sore throat, you don't really have to seek treatment, right?
Yes.
If you isolate yourself for 14 days, you would be out from that mild disease. But if you have severe disease, dizziness, weakness, breathing difficulties, all those things means you have worse manifestation, worse problem, you will need to seek medical advice. And that is when you call the GP or the hospital. Now they have clinics here. They have coronavirus clinics in Sydney. So you have to call them. There's a waiting list there. You have to go there or you have to call them. That's okay. It's part of process. But please be careful about your responsibilities to not get infected and to not infect others. Now, there are a lot of information available. I will ask people to go to the website www.health.gov.au. There's every information there. Do not rely on some WhatsApp information. Do not rely on some claims coming from whichever country that this can claim, this can cure. No. Go to the authoritative and authentic site, and the best site is www.health.gov.au. That's very important. It is so important for us as humans to stop ourselves from getting infected, and of course stop infecting others. That's how we should act at the moment. Be responsible and show your responsibility. That's what I would say. Things are changing. The data is increasing, and we do not know where we would go from tomorrow onwards. We do not know when we might go into lockdown, like Italy has gone into, or some cities in France have gone into, China went into. Okay, 60 million people were in lockdown. We don't know. It depends on what happens tomorrow.
We have to cure as soon as possible.
Well, cure we don't have. We can only prevent. There's no cure. So what is happening is that we have a national government or cabinet. Prime Minister Scott Morrison is the head of that, and all the premiers and all the chief ministers are part of that cabinet. They are meeting twice a week.
Yeah.
They are meeting tonight. And they are analyzing the data given to them by the public health units, given to them by Chief Medical Officer, Professor Brendan Murphy, and Dr. Kerry Chant from New South Wales. They are giving the information and advice to the national cabinet, and they will decide based on the data what they should do. Lockdown karna hai. If we have to do lockdown, they will decide. We should listen to the government. We should listen to the advice given by the Chief Medical Officer. And we should always listen to the advice given by the authentic and authoritative and valid health education information site, which is www.health.gov.au.
And Dr. Ji, thank you for your time today. And before wrap up, before you want to say the last message to everybody,
I would just say one thing, my friends. A couple of things we can do to reduce the risk of infection coming to us or going to somebody else. No body contact, no handshaking, and namaste, and avoiding crowds, and of course practicing following personal hygiene things. This is the right time. Wash your hands frequently, use sanitizer, say alcohol based sanitizers, and keep a gap between yourself and others at least 4.5 feet. Information only from authentic sites, which is, again I repeat, www.health.gov.au. Thank you very much. Look after yourself and look after people around you. Thank you.